Hello, my name's Hannah Morgan. I'm Head of Operations here at the Good Care Group, and today we're talking all things infection control. The Good Care Group are committed to maintaining the lowest possible infection rates, and that's amongst our clients and our carer groups. And we're incredibly proud of the work that everybody's put in to maintaining the lowest possible infection rates across the last 16 months. So all of our carers receive in-house training on infection control, specifically around the coronavirus and other infections. So we really stress the importance of good hand hygiene and good respiratory hygiene. So the carers are kind of highly aware about how effective that is in minimising the spread of any infections. Each of our clients has a personalised and individual care plan, and within that we'll do an individual risk assessment, taking into account the balance of the client's preferences, their needs and wishes, and balancing that with the safety of our carer and client. So, for example, some clients would prefer our carers to wear full PPE. So when I say full PPE, I mean a mask, gloves, and apron at all times. They might be slightly more cautious about the risk to them, and other clients would prefer that because it's their home, that might not be so comfortable for them, or they might have some communication needs, which mean that actually wearing a mask isn't their preference. So we will work really closely with the care team, the client and their family or representatives to make sure we've taken into account all of their needs and wishes and fed that into the risk assessment that will be individualised for each placement. The Good Care Group have developed robust and comprehensive guidance documents that are issued to all of our carers and our head office teams around what we expect in terms of infection control, what the current guidance is across England and Scotland, and their role and responsibilities to making sure that that is put into practice in placement. We have a team of senior managers who meet up very regularly at the Good Care Group to review current legislation, current policies, any change in what's expected of us as a care provider. We'll make sure that these policies and guidance documents are kept as up to date as possible and distributed to the care team very frequently with any updates so that they know what they're expected of them. The Good Care Group participate in a weekly testing programme. So this is part of the NHS test and trace infection control procedure. So each carer is provided with a PCR test to complete each week. And this is to make sure that any carers who are asymptomatic and don't have any symptoms and feel very well, that we spot any asymptomatic carers to obviously prevent them from passing it on to any of our clients or carers. And that's been incredibly effective. We have really high uptake and we keep encouraging our carers to participate in that. We're really pleased to say that the vast majority of our carers have received their COVID vaccination. We've had a really high uptake across the carer population, and we're continuing to educate, encourage, and support carers to get vaccinated as quickly as possible.